This is Dr. Ada from DestroySocialAnxiety.com, and today I wanted to talk about the role of alcohol in people with social anxiety. I mentioned it briefly before in my previous video about how alcohol works. I just wanted to briefly review it. Essentially, it has few components, but the most important one is working on the neurotransmitter called GABA, which is gamma aminobutyric acid. But for our purposes, we are going to call it GABA, which essentially is like a brake in our nervous system. It slows down the nervous system, and it also has other elements of action, such as increasing dopamine level and increasing serotonin. And when that happens, we tend to be a little bit, or actually it depends on how much we drink, but we are quite disinhibited socially. And that is, I believe, one of the main reasons why people with social anxiety turn to alcohol and use it. Okay, the similar pharmacological form of that resolving that issue is using benzodiazepines, which are medications such as Xanax, Valium, Ativan, Klonopin. There are plenty of others, but these are the most common used benzodiazepines in the States. I'm sure in other countries it's a similar groups of use. And the difference between them and alcohol is that they mostly work on GABA, GABA only, without the effect of serotonin and dopamine, which is interesting. But the GABA effect is enough to resolve the issue of anxiety in social situations. Okay. Now, what is the problem then, one could ask, with using the alcohol or benzodiazepines in treating social anxiety? Okay. Well, there are several problems with doing that. First of all, it is my belief that they are not long-term solutions. It's a band-aid. It addresses the symptom, but without resolving the issue. So without it, you can never address the social anxiety per se. Okay? So that's number one. Number two is both substances have the effect of tolerance and possible dependence. It means that with chronic use or regular use, your body gets used to them, and with time we need to use more or more of it to get the same effect. Okay? And with the same amount of use, the effect gets smaller and smaller and smaller. The end result is that we become dependent on either alcohol or benzodiazepines, and slowly, typically, our functioning deteriorates. In addition, there are plenty of reasons why one should not drink alcohol, or for example, with chronic use there is severe liver damage. Okay, the neurological side effects that, for example, may demonstrate themselves in poor memory and decrease in cognitive function. Obviously, it affects our functioning the next day. The syndrome of hangover. It does not allow us to function, and we waste plenty of time doing that. Not talking even about the cost, expense. But the main issue is that the way I look at the benzodiazepines and things like alcohol is, it's like borrowing money that you don't have. It's like using a credit card to buy stuff when you don't have money to pay for them. So we feel bad, we are depressed, we are worried about the feeling anxious in social situations. We take the credit card, we swipe it, we buy the pair of shoes that makes us feel better at the given moment, and we do feel better the moment we are doing this because we are getting brand new shoes that smell nice, look nice, and we can wear them for that time. We feel good in them, you feel a little bit better, things are looking good. However, at the end of the month of the billing cycle, you need to pay it back. And usually what happens is there is a bill and then there's interest on it, and since you don't have money anyway, you kind of compound the problem, and each month it's becoming more and more money to pay for which you don't have, you are not able to pay. Similarly with the benzodiazepines and alcohol. Obviously, I'm making a point here. I'm not saying that every person that drinks develops this problem, but the principle is kind of similar. That at the end of the cycle, we are not really getting better. Okay, we may feel better at that moment when we go out, when we drink, and we feel this moment that we are doing better, but essentially we are not. And the next day we feel worse, and if we don't maintain the level of the medications that we had, we kind of feel actually worse than we began. And that is in a situation when we don't control what we are doing. So the concept in general is that it's okay to use things like benzodiazepines, but in a very concrete situations, in very well designed situations in which we control the process and we control the outcome. If you do this way, you have a much better chance of addressing the problem, in my opinion. What most of people do is they just take the medications, okay, and don't do anything else. So they take it, they feel better when the anxiety has decreased when you take the medication, and the process ends until the next time they take medication. Similarly with with alcohol, when people drink, they basically drink at a party, they get intoxicated, they feel good during that time, then they stop, they feel bad the next day, and until the next time when they drink again. Okay? And the idea is that, in my view, that's not a constructive process. That's usually a road to nowhere. From my experience, from observing my patients, the real solution would be to use things like benzodiazepines only in a controlled environment. For example, we decide today I'm going to do something different about my social interactions. I'm going to challenge myself to do things differently. Yes, and because it's very difficult for me to do it without some kind of induction agent, I will use a little bit of Xanax or Valium just for tonight when I have this goal to attain. Or I could even do it with alcohol. Again, it's not an ideal solution. I think medications are a little bit better because it's much more the dose is much more precise, okay, and we can control it much better. And when you do that this way, I think you have a much better chance of achieving a long-term success, because you're using the agents only as an induction to your goal, which is like getting stimulating drink before you're working out, but you are actually working out. The use of benzodiazepines and alcohol just for social anxiety without doing anything, to me, is like taking steroids, which is a bad thing, and not exercising. I mean, you may feel some effect, but really there is objectively nothing going on here except you feeling better in the very moment. Okay, and that would be my 2 cents on the issue of alcohol, benzodiazepines, and social anxiety. Needless to say that a lot of people with social anxiety, because of the alleviating effect of the alcohol, tend to develop problems with alcohol, and some of the patients with alcohol dependence originally started wanting to just address their social anxiety, and they ended up in a big trouble later on in their life. Thank you very much.